Before she goes through, I want you guys to have a mindset as it's going through. This is going to help this stuff make sense, right? I want you to think about how this stuff affects the body, right? And then it'll help you understand why the symptoms present the way they do for these certain agents. And it'll make more sense as you're studying through them, okay? I'll kind of hit on those points as we're going through it, but I want you guys to kind of have that mindset when she starts.
All right, y'all ready? This should be a review for most of you, so I'm just going to go by quick. If you have any questions, please don't be afraid to ask, all right? I got ADD. Here we go. Okay, so starting off right off the bat, chemical agents, right? Some history on a chemical agent, right? First used in large scale in World War I, right, by the Germans. That'll come in later, as far as naming some of the agents. But fluorine was deadly against unprotected soldiers. As you see here, it's estimated to kill like over 1,000 were killed in its first use in, I think, Germany. The Germans weren't prepared on how effective it would be initially, so they were unable to capitalize on it in World War I. But yeah, it killed a good amount of people, but there was 5,000 casualties overall. For the Iran-Iraq war, let's see.
The first one.
Yeah. Killed or estimated, was 1,800 metric tons of mustard gas were used against Iran during the war. Okay, that's a lot. The last SM attack was Iraq, and that was in July '88. This background, you're not going to really remember this, but that's okay. Okay, and then I believe the sarin gas one, it killed 13 people in the subway. Fun facts. Okay, overview. Chemical weapons are defined as any chemical which, through its action, right, can threaten the life or cause death. Temporary incapacitation or permanent harm to humans, animals. General stuff, we all know this. Can be released, aircraft, munitions, right, CS gas, dropped from aircrafts, I guess. Sprays, smoke generators.
What's another name for pulmonary agents?
Oh, we get it here.
I want to say that because they will phrase it either way on the test.
Yeah, how many of you guys are FMF? Okay, so this definitely should be a review, right? So there's things that we learned in the FMF core, right? The two that we won't be covering are vomiting and incapacitating agents. They don't have that in here. But they will have everything else. And then pulmonary, as HM1 was saying, that's also known as choking. Okay? So when you're looking at the core manual or the core FMF book, it's just named pulmonary, but it's choking. Okay? As far as this is just, a lot of it's pure memorization. You can make up funny things. I have some notes here when we get into the individual categories of chemical agents, just to help memorize. But strictly memorization, I just have some tools to help you do that, okay? As far as the detection equipment, we got M9 chemical agent detection paper, right, most widely used, mainly for nerve and blister. M8 chemical agent detector paper, right, it'll change color, yellow, olive, red, gold, green, or purple for some, it just depends. Chemical agent detector kit, detects nerve gas, mustard gas, cyanide. Okay.
So easy way right now, right, because they're going to ask what's included in your chemical agent detector kit, right? Keywords there, it says indicates presence, right, of the nerve and blister agents is your M9. The M8 actually tells you what the agent is, right? So if it's going to tell you what the agent is, it's usually going to be in your chemical agent detector kit, right? So if they ask what paper is in that kit, it is M8.
All right, personal protection. We're all familiar with MOP, pretty much. Okay, super easy. As far as the J list, this is going to be just the norm. Your M40 mask with hood, gloves, boots, mop levels. As you can see to the right, there's skin decon within 1 minute, detailed use in nav, med, P5041.
There's an easy way to remember the mop levels that can help you out here, right? I think about putting clothes on in the morning, right? So mop level 1, you're not wearing anything, you just have it available when you're carrying your mask or hood. Mop level 1, you're putting on your shirt or your overgarment. Mop level 2, once you put your shirt and overgarment on, you're putting on your boots, right? Mop level 3, you have your overgarment, your boots, and now you have your mask or hood, right? And then mop level 4, right, is after we put our mask on, we want to put our gloves on, so that'll be mop level 4. Does that make sense? So nothing, overgarment, and boots, and then overgarment, boots, and mask, and then overgarment, boots, mask, and gloves.
Everything just gradually increases. Yes.
Just to clarify, did you say that M9 tells you the presence of it and M8 tells you what it is?
Correct.
Questions? Very good. Okay, so as far as the chemical agents, definitely remember those abbreviations for it, right? This little tidbits. As far as the G series of nerve agents, G comes from the Germans. They were the first to develop these nerve agents and use it on people. So that's where the G series comes from. So when you think of nerve, you think of the nerve G as far as VX, right? Just correlate those somehow. But nerve comes from the Germans. The Germans have the nerve to use these on people. Okay, World War II, World War I. And those are going to affect the nervous system, right? So, like HM1 was saying, think about how it affects the people. So it's going to affect their nervous system and parasympathetic nervous system. Okay. So the VX, you'll see this. So don't get this confused either with mustard, because mustard also has an oily appearance, but VX also has an oily consistency. You'll see it compared to like motor oil. Okay. Any questions on that? Again, as far as treatment, this is like one of two categories that gets treated with atropine. Yeah.
Treatment will always be on the test. Know what treatment is for each agent.
I don't think you guys need to know. I don't know if atropinization is in there, probably not, but general intervals for everything, right? 15 minutes. Wait, questions? You guys good?
Especially the dosage. I don't know why, but they love to mess with you and put dosage of those drugs on the test. So know that it's 2 milligrams atropine, 600 for 2 mcl, and then 10 for diazepam.
For auto injectors, how long do we hold them up to ourselves or to other people?
10 seconds.
Beautiful. Good. All right. As far as blister agents, okay? Blister agents. So if you look at Heinz mustard, Heinz starts with an H, right? This is all mustard gas. Try to correlate it with that. That's the best I got. They start with H except for lewisite, okay? I don't know if you remember that.
The color also helps out too. Has anybody ever tried pouring mustard on your plate without shaking up the bottle first? What does it look like? Oily, colorless to a pale yellow, right?
Yeah. All right. Yeah, but not to get confused, right, with the nerve agent of VX, right? This is a different type of oily, like HM1 was saying, colorless, pale yellow, just like the top parts, the undensed part of the mustard. Okay, super easy, right? For lewisite, they have a specific anti-lewisite antidote for it. Other than that, no specific treatment. Okay. For
Just removing the agent from the body.
Right. For blood agents, right? Usually in a gas form, affects the blood by way of inhalation.
So why do you think this one has such a rapid time frame, right, to be treated? We're talking about blood agents. What did I talk about earlier about blood in relation to shock? What does blood do for the body?
Supplies of oxygen.
Applies oxygen and carries everything to the vital organs, right? So if your bloodstream that pushes blood to all your vital organs is now affected by an agent, right? You have a quick time to get that removed from the bloodstream before it's going to cause death, right? So knowing that fast onset lets you know the time frame here where it says convulsions can happen within 30 seconds if you don't treat blood agents. Does that make sense?
So this is definitely on a cellular level, right? It deprives the blood and organs of oxygen. I guess you won't say. All right. But amyl nitrate, okay? If you have a hard time, remember that. I think of just heart attacks, right? What's happening when someone has a heart attack, the blood isn't perfusing right through the heart. So what do they take? They take some sort of nitrate, okay? So as far as treatment goes, there you go.
And then just know IV sodium thiosulfate has been on the test before too for that agent. Yeah, the method of using sodium thiosulfate is usually, because I think they have two different methods of administering. It's IV and I think like.
Oh, it is on here. Okay.
Yeah.
All right, pulmonary agents, aka choking agents. Okay. Oh, and also make sure you know blisters. Another name for blister agent is vesicants. Okay. But back to pulmonary. So choking agents, right? Think about how it goes about, right? Inhalation, right? I know these are choking agents, right? Swallowing pool water, right? Think of chlorine. I don't know, I'm just correlating things, okay? Because these are all chlorine gases. Well, not all of them. But the main one, most common, is chlorine, right? Think about choking on pool water as a choking agent, okay? We got some chlorine in there. But it really affects the ENT, right? So ear, nose, throat, right? And then lungs. They cause severe irritation or swelling of the respiratory tract. All right. So how are we going to treat that? I don't know. Remove the patient from exposure. All right, get them in some clean air.
So an easy way to remember the smell, because I think of like allergies and summer allergies that people have. Most people will get really like breaking out when it comes with the like grass and hay outside, right? So knowing that, and usually any kind of allergy affects your respiratory and choking and all that. So that's how you'll know that fresh cut grass or hay is related to pulmonary or choking agents.
All right. As far as riot control, we're all familiar with these, right? The boot camp. A little. Relatively non-toxic, right? Produce immediate temporary effect. All right. These are just to get people out of threat mindset and into I can't breathe.
Which one's the standard training agent?
Yes.
CS.
Right. It's going to cause burning, irritation. People are going to freak out, feel like they can't breathe. And what do? We just get them in the fresh air, throw some water at them. That's about it. Super easy. All right, treatment of casualties. So I actually got to see this process done by the Marines. It was fairly interesting, pretty much the same setup. So you have your guards, your sentries at the foot of it, or at the beginning. Then they'll go through, right, the 3 different cycles. Or they'll get separated immediately if they're contaminated, right, and they're showing signs of contamination. So contaminated wounded and contaminated emergency, right? The big difference is that the contaminated wounded, they're not as severely injured or need medical attention as the contaminated wounded. Right, contaminated emergency, they'll need care right then and there in order to stay alive. And then afterwards, they'll be decontaminated. Okay, but we need to make sure that they stay alive first. Contaminated, right, their injuries aren't that crazy, but enough to where we should treat them first, or we decon, or we just, yeah. They can be decon in that area as well. As far as everybody else that got exposed go through the cycle. So the clean wounded is an area evacuation point, right? Try to get them out of there. Biological warfare